So welcome to the Kanata Carleton Provincial By-Election All Candidates meeting. The meeting's been organized tonight and is sponsored by the following community associations. We have the Kanata Beaverbrook, Briarbrook, Brookside, and Morgan's Grant, Kanata Lakes, Arcadia, and the Kanata Green Space Coalition. I'm Danielle McKee. I'm going to be the moderator tonight, and I'm the membership director for the Kanata Lakes Community Association. I'd like to first start by welcoming all of the candidates who are here with us tonight. We have Stephen Warren, Green Party of Ontario. We have Karen McCrimmon, Liberal Party of Ontario, and Melissa Conrad, Ontario NDP. As of Tuesday afternoon, the Ontario Progressive Candidates Campaign let us know that the candidate would be door knocking tonight, so they can't join us. So this is the candidates that we have with us tonight. And I want to thank you all for taking the time to be here. I know that everyone appreciates being able to hear from you tonight. So to the residents tuning in, the goal of the evening is to provide you, the local voters, with an opportunity to hear directly from the candidates to understand more about who they are, how they're going to serve Kanata Carleton, and what they're going to do as your MPP at Queen's Park. The format of the evening is that the candidates will present opening remarks, followed by their responses to questions, and then have a chance for closing remarks. The questions have been compiled directly from emails that we asked the community to provide us and from the community associations who were organizing tonight. There's several topics that we're going to cover, and we have 6 to 8 questions, and all of the candidates tonight have gotten the themes, but they haven't seen the questions tonight. The order that the candidates are going to speak will change on a rotating basis, so no one candidate is finishing first or last all the time. And the time allocated is 3 minutes for opening remarks, 2 minutes per each question, and then 3 minutes each for closing remarks. The meeting is being recorded and will be available 48 hours after this meeting for anybody who's not able to tune in live. So with that said, we're going to get things started, and we have randomly selected the order of who's going to go first. And we're going to start with opening statements. And I'd like to start with Karen McCrimmon for her remarks first.
All right. Thank you very much, Danielle. And I'd like to thank all the viewers who are here with us tonight. I'm Karen McCrimmon, and I'm running to be your member of provincial parliament. I want to start by acknowledging 2 things. First of all, our community, our members in Barrhaven that were affected by the tornado today, just know that you're in all of our thoughts. Having been a representative of a community that had suffered tornado damage, I know how traumatizing it can be, and that the best thing that we can do is reach out and be there for one another. And I know that the people of Barrhaven can count on the rest of us to be there for them. Secondly, I'd also like to talk about the fact that there's no progressive conservative candidate here. I mean, this really is, to me, this is a job interview. This is something you have to have the opportunity to kind of interview us. This is your chance to interview us and ask us those questions. And I personally, I think the disrespect is unacceptable. And as my mother would say, whatever behavior you reward is the behavior you're going to get. And this is not a behavior that we should reward, in my opinion. So I'm running to be your MPP because I am a strong believer in the public sector. I believe in strong public health care, strong public education, strong public services, and protected green spaces. And what I'm seeing now at the provincial level is that so much of that is under threat. I'm seeing parts of it being dismantled and sold off for profit. And that's not the future that I want for our community or for our children, for that matter. I think we're on the wrong path, and we have to change that path. I didn't want to wake up someday in the future and say to myself, oh, I should have done something, because together with you, we're going to do something. All right. And it matters. So I just wanted to say that together we can do this. It's all about looking for a better future. And right now, that future is not with the current government. We need a change of government. You know, I was your MP, you know me, I know you. And together we can do this. And it's so important if we're going to have the kind of future that we want here in Kanata Carleton. So I just wanted to say in closing, This matters. This is such an important election to send a message to the Conservatives in Queen's Park that what they are doing is not acceptable to any of us, and that we deserve better and we demand better. And I will be here for you to do the same thing. I served you twice as your member of parliament, and I would be only too pleased to serve you as your member of provincial parliament. Thank you.
Thank you very much, Karen, for that opening. And next in line, we have Stephen Warren from the Green Party.
Thank you, Danielle. I want everyone watching here to take a quick moment and imagine a community where we have clean air and clean water, protected green space, public healthcare that you can actually rely upon, where everyone has a family doctor and where you don't have to wait hours on end to see healthcare. Imagine a community where housing is affordable and sustainable so that everyone can have the dream of homeownership. Folks, that is the vision of the Ontario Greens. My name is Stephen Warren, and I am so proud to be your Green Party candidate here for the Kanata Carleton by-election. I'm 19 years old. I'm a student at the University of Ottawa, where I study political science and criminology. I am the son of two amazing working-class parents. I don't come from a fancy background. My father worked for 31 years as an auto worker before he retired. My mother works at Queensway Carleton Hospital as a healthcare worker. We needed an MPP who was going to stand up to Doug Ford, who was going to send a message to Queen's Park that Kanata Carleton has had enough. We need to see real change. And my vision is the plan that will make real change happen for Kanata Carleton communities. Thank you so much.
Thank you for that, Stephen. And the next and last tonight, we have Melissa Conrad from the NDP. Please go ahead.
Thank you, Danielle. Good evening. My name is Melissa Conrad, and I am your Ontario NDP candidate for Kanata Carleton. I would like to acknowledge that we are on the unsurrendered Algonquin Anishinaabe territory. I have been a healthcare worker for 20 years at the Ottawa Hospital as a laboratory technician, and I understand the issues in our healthcare system from the inside, from the lack of healthcare workers to the lack of family doctors and problems with privatization. Earlier this year at work, I had a young woman come into the clinic at the hospital I work at. She was shocked when she was told that she had to pay out of pocket for some of her tests that were not covered by OHIP. She could not afford to have these tests done and didn't have them done. This is the reality of healthcare privatization. As a single mom to a 14-year-old, I understand the out of control cost of living. It's a heavy weight to bear. And the continuous underfunding and cuts in our education system is leaving our children in overcrowded classrooms without resources and the supports they need for success. I have been active and engaged in this community for nearly 2 decades and have met with many of you. I've attended meetings in our fight to save our green space and have been pushing back against the Ford government's aggressive policies. I am running to be your member of provincial parliament for Kanata Carleton because I am fed up with the Ford government, putting insider friends over people in this province. We need someone who has firsthand experience in dealing with the provincial funding cuts and is willing to fight to improve our public healthcare system, advocate for our kids, and protect our green space. Of the candidates here, I am uniquely positioned to be a part of the official opposition and have my voice heard in the legislature. I am excited to get to work, fixing what is broken and holding the Ford government accountable. I am ready to get to work for you and be an MPP that responds to your concerns and fights for you.
Thank you very much, Melissa. Thank you all for those opening statements. Before we get into the official first questions, I thought I'd start it off by asking, You guys have been all campaigning in the area. You've been knocking on doors. You've been talking to people. So the first official question is, what are the top issues that you're hearing from voters as you've been campaigning? And from our random selection, actually the NDP, Melissa, you're first for this one.
Thank you, Danielle. I mean, the top issues that I've been hearing at the door the last number of months that I've been out knocking are healthcare, education, and green space. People are extremely frustrated waiting on lists looking for family physicians. They are extremely fed up with this government's privatization and not looking forward to having to pay out of pocket to see a physician, to get a surgery. They're not comfortable that people who can afford it will jump the line. They understand that it has been decades of underfunding that has been constructively dismantling our healthcare system from the inside out. We don't have healthcare workers. We can't keep healthcare workers. And no one's talking about investing in education for healthcare workers. No one's talking about investing in our colleges and universities so that we can have adequate staffing levels. We need to have a plan to train up internationally trained healthcare workers in all levels, not just nurses and doctors, but all 250 allied health professions within our healthcare system to ensure a sustainable healthcare system moving forward. We're very proud of that in Canada, and we're failing our Ontarians right now in that system. Education is top of mind for people, for parents. The cuts in funding to education are leaving our classroom sizes way too big without supports. Special education is being cut for this coming September year. And parents are very, very concerned about the quality of education based on the lack of resources that we have in our schools. Our educators are very concerned about what this September will look like with the cuts that this government has put forward in the current budget. And we need to make sure that we're investing in this future for our children. We also know that green space out here in Kanata is something that we're very proud of, something that we want to keep. And the Ford government is carving it up and selling it off to the highest bidder right now, trying to carve up our farmland and really take away the green space that we have out here. And we need to focus on densification. We need to focus on building up within the boundaries that we currently have and really have a better variety of housing options like co-ops, low-income builds, as well as some high rises. It's something that we don't have out here in Kanata. We want to make sure that we have housing options for everyone so people can have a safe place to live and a roof over their head.
Thank you. And that brings us to 2 minutes. So thank you for that answer. And second up, Karen, you next. What are the top issues that you feel like you're hearing at the door?
Well, thank you. I think it's really the number one issue is definitely healthcare. That's I would say probably more than 60-70% of the doors I'm at, it's healthcare. So for that, when we're talking about healthcare, a family doctor is probably the number one out of the healthcare bucket. Okay. So we know that 2.2 million Ontarians don't have a family doctor. And we also know through research that having a family doctor makes such a huge difference in your overall health. Family doctors can do preventative care. They can monitor, they can create a path for people to improve their health. And that kind of coaching and mentoring that family doctors do is so important. And with 2.2 million people without a family doctor, that's hard to do. Family doctors also help keep people from needing the services of the emergency departments as much, because they can help them manage more chronic conditions over time. So we don't end up with people at the emergency rooms as often as we are now. So that I don't think a lot of people understand just how critical that is, the lack of a family doctor. And I do think there is no silver bullet here, but there are things that we can do to actually make a difference. And I think if we look at how licensing is done in this country right now, there is an argument for national licensing for all of healthcare workers. And I think that's definitely an idea worth looking into. Australia did that about 13 years ago, and it's actually, they've reaped the benefits of having done that. So that's just one idea. As well, I mean, we're talking about the regulatory bodies. How are they actually managing people who bring qualifications from other parts of the world? And I've heard stories on the doorstep that the doctors are trained, like in the United States. They have a license in the United States, but they cannot come back to Canada, and their license isn't good enough, but it's good enough to the United States, but not for Canada. See, that doesn't make sense. And there are other countries around the world that are in the same, and we're not taking advantage of those kind of resources, and we need to.
Thank you. And I say thank you. Thank you for that. The 2 minutes was up, but I appreciate hearing that from you. And finally, Stephen, in your campaigning, what are you hearing as the top issues in Kanata right now, Kanata Carleton right now?
When I've been door knocking in Kanata Carleton, I've heard from folks that these have been challenging times. Healthcare is being attacked. People don't have family doctors. People in our community can't access the public healthcare that they need. Our green space is being paved over. The great lands, the farmlands, the rivers, they're being polluted. And the Ford government just isn't taking action to protect our environment. Housing has become incredibly unaffordable. Young people like myself, we can't afford housing. Housing ownership is just out of reach for all of us. People can't afford to make rent payments. Rent has been going up. What I've been hearing, Kanata Carleton residents need real change, and that we need an MPP who's going to present that real vision. Thank you.
Thank you very much. Thank you all for those comments. I know that there's probably many issues, but I hear a theme from all of you, so I appreciate that. Now, as we get into our questions, I'm just going to give a short preamble based to kind of highlight some of the Kanata North topics, and then we'll get into the first question about community growth. As all of you probably know, Kanata North is home to one of Ontario's key economic drivers, the Kanata North Tech Park. It's one of the fastest growing communities in Canada here in Kanata North as well. And our community has so much to be proud of, and we know that it's a great place to live. We also know that as we grow, there's challenges to consider. The province plays a key role in planning and planning and related legislation, and is directly responsible for healthcare, education, electrical generation and distribution, among other things. And the province is also the primary funder, along with the federal government, of capital funding for the city for new and upgraded community infrastructure. Keeping this in mind, our community is concerned about some of the challenges that other communities across Ontario are facing, namely housing affordability, affordable housing, the cost of living increasing, preserving green space, supporting the environment, education, healthcare, as all of you have mentioned, and transportation. All of this is related to high residential growth, population growth. And while most of us would agree there's a need for more housing, our community wants to ensure that there's adequate supporting infrastructure to manage that growth. And to just give a quick perspective, in 2020, Kanata North had approximately 14,000 residential homes. That's apartments, condos, townhouses. And on the books, there's approvals for 21,000 additional residential units. So that represents a growth over the next 15 years of 150%. And our community is looking for what's the supporting infrastructure to go along with that, considering all factors. And that leads into the very first question, thinking specifically about Kanata. When the first residential community was built here by Bill Terron, the initial properties in the tech park, it featured housing that was priced for a wide range of income and demographics. Today, residential development is almost entirely by the for-profit sector here in Kanata North. And there's very few affordable options for those that aren't making a higher income salary or those benefiting from things like downsizing. So I'm going to say this two-part question. The first part is, how would you work with the City of Ottawa to tackle the existing challenges with housing for people in our city of all income levels? And I'm going to ask the first question goes to the Green Party candidate, Stephen Warren.
Thank you for the question, Danielle. The Ontario Greens present the real solutions that are going to create affordable and sustainable housing. We can no longer afford Doug Ford's expensive urban sprawl agenda. We need to protect our green space, and we need to ensure that we build housing that works for people. Homes should be for people. Homes should not be for wealthy speculators. The Ontario Greens present real solutions. We're going to change municipal bylaws so that we can have housing for the people, that housing can be for what housing needs to be, instead of housing for profit. Thank you so much.
Thank you very much. And next question goes to Melissa from the NDP.
Thank you, Danielle. First of all, we need to bring back real rent control. People shouldn't have to be paying their entire monthly income to housing. We have a variety of public tools, including a strong emphasis on public investments and non-market housing, that we can build affordable housing that we need right now. We don't have to pave over our green space to make that happen. We know the private sector can't keep up with affordable housing demands. That's why the NDP has approved a new public agency with the responsibility of financing and building hundreds of thousands of new affordable non-market homes to be operated by public, co-op, or the nonprofit sector. We believe that people should be able to get a safe, affordable place to call their own when they're ready to buy it, and that homes shouldn't be out of reach for hardworking families like they currently are. Ford is extremely cozy with developers and making insider deals that don't benefit you and I. And we understand that Ontario needs 1.5 million homes to keep up with the demand, as we've seen in the addition of 21,000 just for Kanata North. So as a member of provincial parliament, it is our responsibility to advocate for funding and work with municipalities to plan communities in our neighborhoods that really fit the people that currently live there and that want to live there, so that everyone has the opportunity to buy a home that they work in, grew up in, or choose to stay in.
Thank you. And Karen.
Excellent question. And I think when we think about the multi-level requirements, what we need to build more affordable housing, you have to be able to work with the federal government, with the provincial government, with the municipal governments. You need to be able to draw in the expertise from all three levels. And without that kind of cooperation, we're not going to be able to build the kind of affordable housing that we need. What we need is sustainable, responsible development. And we should never pave over green space in order to make that happen. There is place here to build more affordable homes. And it needs to be responsible because it needs to be linked to transit. It needs to have the available infrastructure already in place. And to try and crowd things in an area where that infrastructure does not exist makes no sense. And I've also seen suggestions that some of the stormwater planning that needs to be done, there's been suggested there could be shortcuts. That would be the absolute wrong thing to do. When it comes to stormwater planning, that's what the developers, they don't want to do it because it is expensive. But years from now, when we're dealing in the future with floods, it'll be the residents that will have to deal with that. So I think there are processes in place that you need the plans, you need the cooperation, you need the connections and the networks. And I think getting all those people together to make this work for people, I think that's absolutely going to be the key. Thank you.
Thank you. And you kind of delved into the second part of the question, and you're the first one to answer the next part of this question. If you were the MPP for the area, how would you ensure the community of Kanata North thrives with balanced planning and investment in housing and critical community infrastructure?
Yeah, excellent question. And okay, so I probably answered part of that already, because And I do believe in it, okay? And I also have a background in mediation. So yes, I have a strategic planning background, and I also have a background in mediation. So this is what we need. We need people who can talk to all levels of government, who have the credibility to be able to reach out to people and say, okay, we have an issue here. How are we going to plan for this? How are we going to make this better for the future? I mean, when I was working with the high-tech park in Kanata, we worked really hard to get the kind of investment we needed in order to see that park grow. And it's growing. It's doing really well. We have a lot to be proud of here in Kanata North. And with the example, I think, set by Bill Tarrant all those years ago, he understands that a full community with all the amenities it needs, where you can live and work and play, is the key to a better life, right? So that's what we need. We need to have that vision in our mind when we're coming up with these plans about how we're going to help Kanata North continue to grow sustainably over time. There should not be any shortcuts. We need to do this right, because this will be the foundation of our future development. And if we attract people here to Kanata who have the skills and talents, and if we can give them a quality of life so that they want to stay here and raise their children here, that's going to help us develop the economy of the future. And that will help us to keep the jobs here that are so important. So it's about finding that cooperative ventures in order to make this happen in the future. Thank you.
Thank you very much for that. And the second part of the question to you, Stephen, from the Green Party, how will you ensure, if you're the MPP, balance planning and investment in critical infrastructure and housing?
We keep talking about protecting our green space, but let's be clear here. Actions speak louder than words. It should be illegal to pave over green space. Green spaces are vital in the fight against climate change. And by investing in climate change, we can create sustainable development and grow the economy of Kanata North. My plan would invest in clean green tech jobs in Kanata North. That would create new job opportunities here. Climate action is job action. It's simple as that. By investing to protect our environment, to protect our communities from the worsening climate crisis, we can grow our economy sustainably and create new jobs. Thank you.
Thank you very much. Melissa, last one to you for this question.
Thanks, Danielle. We know that as Kanata North grows, that we need to ensure transit infrastructure. We know that people want to have clean transit to get downtown, to get to work, to get around. That is extremely unreliable and unavailable in Kanata right now. We know that with the expansion of homes, that we're going to have more people looking for more healthcare, that we need to fight for a family health team, family health hub out here in Kanata, an urgent care center, so that people don't have to go out to Kempville, out to Carleton Place, or to the Queens by Carleton Hospital to get care. We need to ensure that we have that health infrastructure out here. We need to ensure that our schools have the appropriate capacity for the students that will be moving into these homes and the families as they grow. And with that, we need to ensure that we have green technology, renewable technologies in our communities, on our provincial buildings, on our schools, so that our grid can handle it. Because right now we have increasing number of blackouts and brownouts in Kanata. Every time there's a storm, we rely heavily on our hardworking Ontario Hydro workers to get us up and running, but we need to alleviate the system. And we have that ability out here as we expand. We have a unique opportunity that as we develop communities, that we develop green technology right into it. And we need to remember that Doug Ford is still going to be in government after this by-election, and we need a strong voice in opposition and build towards a new government in 2026. This is a by-election where we can send a message that Kanata Carleton cannot be taken for granted. And I will fight tooth and nail to support Kanata as a member of the official opposition.
Thank you very much. And the next question goes in, it kind of goes along the theme. It's about our green space in particular. Talking to Kanata North residents, along with high-tech recruiters, people move here and stay here due to easy access to natural trail networks, general green space, places for children to play, outdoor living, activities right on our doorstep year-round. However, with the newer subdivisions being built to maximize housing density, it sometimes can come at the expense of green space. So it follows the same theme as the first question, but more specifically, Kanata North is vulnerable to storm management issues and due to the underlying bedrock, drainage options, etc. And as we talk about the Kanata golf course and that 40% agreement that exists, this question is quite specific for our area because we are representing the Kanata North Community Associations. Knowing that Club Links is seeking to supersede the 40% green space agreement that exists and to develop the 175 acres of existing accessible green space that's well utilized by residents. What is your view of this issue? And will you support the Kanata Green Space Protection Coalition and the City of Ottawa as they lead community opposition to their proposal? Each of you 2 minutes, and the first one of this one is Melissa from the NDP.
Thank you, Danielle. I think my position has been very clear and consistent. I will protect this green space in Kanata Carleton. And as a member of the official opposition, I will have more tools at my disposal to help protect this green space than any other candidate here. A deal is a deal. When this community was built, the golf course was part of the deal that is the 40% that would stay as green space. And we know that the Green Space Coalition and the community has rallied behind this initiative, raised hundreds of thousands of dollars to keep this golf course as a green space. And I will absolutely advocate for that as part of the official opposition at Queen's Park.
Thank you for that. And next one, over to you, Karen, on this one.
Thank you. Excellent question. I've been a member of the Green Space Coalition for many years and a big supporter as well. I think it's absolutely key. I think providing a quality of life here, and I think that's what has attracted so many talented people to come here and make Kanata their home. I think it's absolutely key, not only to our economic well-being, but also our health well-being. We know how much it matters and what a difference it makes in people's health. So I'm fully prepared. I believe that if we're going to succeed in protecting this green space, we're going to have to fight for it. There's no two ways around this. This is not going to be easy. And the Conservative government is in the helping the developers, let's say. And so it's going to be up to us. And already the Green Space Coalition is showing the way forward. They have raised money, they have gone to court, they have engaged lawyers, they are on top of this issue. And this is all community-based advocacy, like unbelievable talent and commitment to the protection of this green space. I will be there with them. I'm prepared to fight for this, for the people of Kanata Carleton, because it matters. Because once we lose one piece of this, okay, if that precedent gets set, there will be more, and it won't ever stop. So this is our line in the sand. It has to be our line in the sand here in Kanata Carleton. I will be standing together, shoulder to shoulder with others who are going to fight for this as well. This is the key to our future health and our future prosperity, and together we're going to have to fight for it.
Thank you very much. And Stephen, over to you for the last one.
Thank you, Danielle. We are living in a climate crisis, and Kanata North residents are living on the front lines. We need to take action immediately if we want to protect our communities for the future generations. That means we need to protect all of our green space. Green space is vital in the fight against climate change, which we know is happening and is real. We have seen the effects of climate change with recent storms in the past few years. I will absolutely and always stand with the Green Space Coalition. I will protect the green space. I will absolutely not let developers have their way. Thank you.
Thank you very much. And I think I know the community will be happy to hear all of your answers on this one. Thank you very much. We'll move on to the next topic. It's going to be around healthcare, which is something I think all of you mentioned as one of the top issues you've been hearing, which is probably not a surprise. So next to housing, we say healthcare is rising as the most pressing issue for residents of Kanata North, similar to many people in Ontario. The rising number of people who don't have a primary doctor, the increased use of walk-in clinics seen by large wait times, the increased wait times in emergency rooms, the lack of access to critical mental and physical medical services, plus increasing out-of-pocket expenses for services and increasingly expensive medication are all symptoms of a healthcare system in need of attention. And additionally, in Kanata North, access to long-term care for our aging seniors is effectively private facilities. So the first part of this question is, what actions will you take to address the ongoing healthcare system challenges to ensure people have access to appropriate, timely, and quality healthcare within our publicly funded system? And the first one for that one is Stephen with the Green Party.
Thank you, Danielle. As we all know, healthcare is in a crisis. We need to take action now to protect our public healthcare system. Nurses and healthcare workers are walking off the job. We need to repeal Bill 124. We need to ensure that all of our healthcare workers get the support that they need. People shouldn't be waiting for hours on end to see a doctor in an emergency room. This is Ontario, a place where we should have reliable public health care. And right now, this Ford government is spending our taxpayer dollars to privatize healthcare. We need to stick with the public healthcare system. We need to ensure that everyone in our community has reliable and accessible public health care, and we need to ensure that everyone has a family doctor. Thank you.
Thank you very much. Next one, Melissa from the NDP, please.
Thank you, Danielle. This election is a referendum on Doug Ford's healthcare policies. I am the only healthcare worker on the ballot. I get it. Things are horrible from the inside out. We need to look at where we need more healthcare workers. There are over 250 allied health professions that make a hospital run, and we are suffering in all of them. We need to invest in graduating more healthcare workers and not just giving CEOs of hospitals more money to do what they want, because that isn't working right now. We have 10,000 internationally trained doctors and physicians not working in our hospitals. We need to increase residency spots. If we increase residency spots in Ottawa and all across Ontario, we could have an accurate number of physicians for every Ontarian to have a family physician and for our emergency departments to stay opened. We need a process to evaluate these internationally trained physicians and get them into residencies. One of the leading Liberal leader candidates has said that they feel like we are spending too much on healthcare in Ontario. And the Conservative candidate who didn't show up tonight used to lobby for Big Pharma. I am the only frontline worker here, and the people in Kanata need someone who has been fighting for patients rather than pharmaceutical industries as their representative. I know the issues from the inside, and I will work with the government and the official opposition to identify areas that we can correct immediately and make a long-term plan for a sustainable healthcare system in Ontario.
Thank you very much for that, Melissa. And over to Karen with the Liberal Party, please.
Thank you, Danielle. I think when I think about this, I think what we need is more community care, more in community care, more family doctors. There is nothing west of Queensway Carleton Hospital. There is no community hub, no community care hub. There's no urgent care clinic, nothing west of the Queensway Hospital. And Kanata and Stittsville are both growing so rapidly. Orleans has had an urgent care clinic for years. And we need exactly the same thing. It can make a huge difference in the function of emergency rooms if only the urgent issues go to an urgent care center, because the infrastructure in an emergency room, there's only a limited amount of it. So if we can find a way to divert non-emergency cases to an urgent care clinic and deal with them there, that will make things better. We also need more nurse practitioners. We need more other healthcare professionals to help doctors. Listen, doctors just want a doctor, all right? And when we have some healthcare teams in this area, they are a tremendous asset. And that's how doctors want to work. And if we can pair doctors with health records professionals and with nurse practitioners and other healthcare professionals and let them do the job that they want to do, we'll keep them on the job. Right now, we're burning through our doctors. We're burning them out. And we have to find a way to give them a quality of life as well. And I think more community care and more doctors is the answer. And there are things we can do about that.
Thank you for that. And the second part of this question, and Karen with the Liberal Party, you're going to be the first one for the second part of the question, but it ties right into it. Everyone talked about healthcare, doctors, primary care. And the second question is, what actions will you take to address capacity and quality of long-term care facilities, including those funded by OHIP?
Thank you for that question. I just want to say, I'm grateful to the Canadian Armed Forces who went into some of our long-term care homes and showed us the reality of what was going on there. And I think all of us should keep that testimony in mind when we're designing what we want the future of long-term care to look like. I don't want to see profit in long-term care. I don't want to see profit in healthcare, period. When there is an overriding motive of profit, the patient is never going to be the winner, okay? The shareholder will be the winner. We need public health that is very patient-centric, where we do things that are best for the patient. And the same goes for long-term care. So I know that there are now national standards for long-term care. Now, how do we do the enforcement? How do we do the inspections to make sure that those standards are going to be met and to make sure that there are no loopholes? There have been loopholes in the past, and all those loopholes need to be closed. It's going to take comprehensive work and cooperative work between the federal government and the province to come up with a way forward. Listen, I would prefer to use a carrot to actually incentivize people to raise their standards up to the standards or even beat the standards that the federal government has set. But I'm also not afraid to use the stick when it's appropriate, because these seniors, they deserve the best of care, right? This is what they deserve. They have spent their lives building this country to the place it is today. They deserve our respect and our care. Thank you.
Thank you very much for that, Karen. Next, Stephen with the Green Party, please.
As we have seen through the COVID-19 pandemic, and even today, seniors in long-term care have been left to suffer, with many of whom living in inhumane conditions. This is a human rights concern, and we have seen that privatized long-term care that seeks to make profit instead of caring for seniors, it absolutely does not work. We need to hear solutions, and my solution is investing in home care. By investing in home care, we allow seniors to live in their own homes, where they can live in peace and dignity. And that doesn't break the bank. It is actually more affordable to invest taxpayer dollars in home care rather than long-term care. We absolutely need to see these solutions on the long-term care portfolio implemented immediately. No senior should ever live in inhumane conditions. Thank you.
Thank you very much. And Melissa with the NDP, please.
Thank you, Danielle. Well, we know that Ford has cozy relationships with private long-term care operators who are in it for the real estate profitability and he has renewed their licenses, even to some of the worst offenders during the pandemic, without enforcing any compliance for inspections. It's extremely shameful and embarrassing in Ontario. Here in Kanata Carleton, we uniquely know the long-term care system, as we had an MPP who was responsible for our loved ones and failed our families. We need to make it about people and care, not profits. I am deeply concerned about our loved ones currently in long-term care and those going into long-term care homes in the future. We need to fight, and the Ontario NDP as the official opposition will fight to make long-term care homes part of public healthcare system, to take the profit out and enforce compliance to inspections. I spoke to a 93-year-old woman today who is still in her home and grateful to be there with home care and not in a long-term care home because of the stories that she's heard. We need to invest in home care. We need to support our workers, give them a living wage, and because they take care of our loved ones in their homes for as long as possible. This will alleviate the demand on hospitals and long-term care homes. And currently with the Ford government, our loved ones, they're being shuffled out of hospitals into homes that they don't really want to go into. They're not having a choice with Bill 7. We need to ensure that as the official opposition, we are advocating for your loved ones who are in long-term care and in hospitals, so they are not being forced into homes that they don't want to be in. And that's what the Ontario NDP is doing and will continue to do.
Thank you very much, Melissa. I'd like to say to everybody, we are rolling along right on time. So thank you very much for sticking to the format. The next question we're going to touch on tonight is transportation related. So along the same themes, transportation is part of critical infrastructure. As a suburban community, vehicles are a major part of how people get around, and investments in roads is essential. At the same time, our community would benefit from improved access to public transportation within our community of Kanata North, Kanata South, and also within our city going downtown to Orleans to Barrhaven. The bus system and the LRT system can improve this connectivity. The first part of this question is, how will you and your party work with the City of Ottawa to ensure transportation, including new and upgraded roads, public transit, including LRT and buses, remain funded to provide the service that our city needs? And the first one for that is Melissa with the NDP, please.
Thank you, Danielle. This is a big issue. And the first thing that we need to do is have no more public-private partnerships. Our light rail train system in Ottawa has been nothing but a train wreck so far. The NDP will invest more funding into transportation. We want to bring back the 50% co-pay for operating costs of public transit to cities. This will lower the cost to riders and allow the city to take their investments elsewhere in transit, whether it's bus routes, bike lanes, or road infrastructure. The Ford Conservatives canceled this program. They canceled the 50% copay funding. It is the NDP who got the Auditor General inquiry into the LRT. That's what you get with a member of the official opposition in your corner, and that's what I will continue to do for Kanata. I talked to Beth today when I was out at the doors, and she takes public transit to work every day. She's been taking it for years in Ottawa. It now takes her over an hour and a half to get from home to work. She spends more than 3 hours a day on public transit because our system is not good enough. We know that. Both the Liberal and Conservative governments have promised to lower auto insurance rates so people could continue to have cars, have 2 cars in their household. But they've sided consistently with the insurance companies and never took them on. The NDP believes that not only do we need to invest in public transit and infrastructure in large cities like Ottawa, and have the LRT come all the way out to Kanata. But we also believe that if you choose to drive your car, you should be getting better deals on auto insurance. We know that it depends on your postal code to how much you get charged. And we know that that shouldn't be the case. And if I'm your member of provincial parliament with the official opposition, I will continue to advocate for all of these things and ensure that this government continues to fund public transit. And in 2026, that when the NDP becomes the official government, we will bring back the 50% copay for cities.
Thank you very much for that. And next, Karen with the Liberal Party, please.
All right, thank you, Danielle. I think that's absolutely key, transportation. I've heard it as well. And not only the LRT, but also bus rapid transit, that the bus system needs to be improved as well. As I said earlier, the key to our future economic success in Kanata North is to be able to attract the talent we need. Not just talent from around the world, but talent from across the city. So we need effective transportation that will bring workers to the high-tech park, not only to take people from Kanata to work downtown. So we need a system that works two ways, that actually is responsive to our requirements. And I think when we look at the LRT and the bus rapid transit, both of those definitely need to be improved. And it will be the key to whether Kanata can keep growing and our high-tech park can keep growing. So we need that transportation to be more reliable. And I know working with the Federation of Municipalities is going to be key in order to find the right formula to actually support our transit in all of our cities and our municipalities across Ontario. There are some solutions out there, but there is a need for more investment in public transit. It's absolutely key. If we want to see our high-tech park continue to thrive, we need transit that serves the entire city, and that includes Kanata. Thank you.
Thank you very much. Over to you, Stephen, with the Green Party.
Thank you. As we all know, transit is critically important to our community, and investing in public transit will also help advance real climate action and make life more affordable for Kanata residents. People should not be stuck in traffic, spending time in their cars, when instead they could be at home with their families. We absolutely need to invest in public transit that is reliable and efficient. We cannot afford another LRT fiasco. We have to ensure that the province will fund public transportation that remains public, that runs on time. I've talked to many of my peers at U Ottawa who live in Kanata Carleton, and they tell me that they've had to leave class sometimes earlier. They have to get up early, like 2-3 hours early in the morning just to catch the bus, because OT Transpo, the bus doesn't run on time. We have to ensure that the buses run on time, and that we have LRT from.
I think we might have had a little bit of technical glitches there on the end of your question there. Sorry, Stephen. Do you want to continue? Sorry, you got cut off in the last few seconds there.
Oh, no worries. What we're just saying is that we need to invest in public transit, that people should not have to leave 3 hours early to get to work on time. The buses absolutely need to run on time. We can't afford another LRT fiasco. There's no reason for there not to have reliable, efficient LRT from Kanata to downtown. Thank you.
Thank you. Thank you. And the last transportation question, the next one is a little specific. All of you have kind of touched on it when you're talking about public transportation and the investments needed. And some of you have pointed to the challenges with LRT, but knowing that stage 3 of LRT is set to come to Kanata, and there's been a lot of preliminary work done to that. And I think the cost estimate now is about $5 billion to bring it to stage 3, which goes to Kanata and to Barrhaven. Would you and your party be prepared to commit to funding the province's portion of LRT stage 3? And the first person to that is Stephen over here at the Green Party first.
Thank you, Danielle. The Ontario Greens will always and absolutely invest in public transit. As I said before, public transit is vital in the fight against climate change. It makes life more affordable and ensures that people can spend more time at home with their families. We absolutely need to ensure that we have reliable LRT in Kanata so that folks don't have to leave early to make it on time. We have to ensure that the buses run on time. The Ontario Greens present real solutions that we will advocate for. Thank you.
Thank you. And Melissa with the NDP, please.
Thank you, Danielle. The NDP would absolutely fund the province's part of the LRT coming out in stage 3. I think we also need to look ahead to what's next. We're going to need environmental assessments for a further stage to include Stittsville and out into some of the rural areas of Kanata Carleton as well. We are expanding so rapidly that the LRT can't just end at the Kanata station. We will need to look 5-10 years out and plan ahead and continue to fund this as Ottawa continues to grow into Kanata North, into as CARP really gets closer to Kanata. We need to ensure that we have a light rail train system as well as bus infrastructure for that growth as well. And the Ontario NDP would absolutely fund all of that, the province's portion of all of that.
Thank you. It was a specific one, knowing that you guys are one level of government. And Karen with the Liberal Party, please.
Thanks, Danielle. Yeah, I've always been an advocate for the LRT and the bus rapid transit to Kanata. And in fact, I helped get the federal money that did the environmental assessment that will allow this to move forward. Because I absolutely believe it is key to our future growth. And it is key to having the kind of community that we want, green and responsible. We need reliable transit. We need it to be green. And so this is what the aim of LRT and the bus rapid transit really was. I have no doubt that the Ontario Liberals would support this moving forward, continue to support this, and that the federal government feels exactly the same ways. So this is the kind of investment we need. And we need to stop looking at this on such a short time frame. It's right. We need to look longer distance. We need to look long term at the benefits that this can bring to our community. And so this investment, it'll pay us back in no time. And that's what people need to understand. It might seem like a lot of money at first, but over time, we will create the kind of economy, the gross domestic product here in Kanata that'll repay this investment in no time at all. Thank you.
Thank you for that. And I know it's one of those timely topics, every time you talk about transportation, you have to think about all factors. And I appreciate all of your answers tonight. It leads into our last question before we'll go to closing statements. And the last one is broad, but it can be specific. It's about the economy and cost of living. With the cost of living that's risen substantially, things like interest rates on mortgages, the cost to purchase a home, the cost of renting a home, groceries, gas, invisible to many in Kanata North, the Kanata Food Cupboard's annual stats show that Kanata North has a surprising and rising number of seniors on a fixed income, and many families with children are struggling with the cost of living increases. So answer as broad or as specific as you want, but what would you do to offer more support to residents to improve our communities, and what can the province do to help alleviate some of these cost pressures? And the first question that goes to Karen with the Liberal Party, please.
Thank you, Danielle. When I was thinking about this question, I thought to myself, well, the first thing we have to fight off is the privatization of our healthcare. Because if you think it's expensive now, wait until you're paying for private healthcare. Medical debt is the #1 reason for bankruptcy in the United States with its for-profit healthcare. So that's something we have to keep in mind. And that's part of our fight to preserve our public health care. So there are also other things that we can do. I mean, we know where the vulnerable are in our society. I mean, I know the federal government has increased some of the old age supplement and the grocery rebate. They've tried to make a difference. But the same can be done at the provincial level. The province has the same kind of mechanisms to provide people who need more support with more support. So I think this is what we need. We need a province that really cares about its people and is willing to step up, because right now in Kanata Carleton, people are hurting. People are hurting. And so the province doesn't seem intent on actually trying to make a difference in people's lives. And that's what I've always thought that politics should be. It should be about serving people and making people's lives better. So I will commit to you that I will work, however, with whatever partners are out there to make this a better system to serve the people of Kanata Carleton.
Thank you for that. And Stephen with the Green Party, next please.
While Kanata Carleton residents are struggling with the rising cost of living, while we're still paying taxes, this province is sitting on $22 billion in unused funds that could absolutely be invested into reducing the cost of living. By investing in climate action, we will reduce energy expenditures. We will make life more affordable. By creating sustainable and affordable housing, we will ensure that homes are for people and that housing isn't so expensive. We absolutely need to work on these solutions. The Ontario Greens present the real solutions that will ensure that we have fiscal responsibility so that Canada taxpayers don't get taxed crazy while we maintain fully funded public services. Thank you.
Thank you. And finally, Melissa with the NDP, please.
Thanks, Danielle. Well, we all know the cost of living is out of control right now. We pay way too much for utilities. I have a 14-year-old who eats a lot, and my groceries have more than doubled. Housing and rent is unaffordable in Canada. We need to double ODSP and OW. We need to tackle companies like Loblaws, who have a monopoly on grocery increases and what they charge. The Conservative candidate has lobbied for Galen Weston and the Loblaws company, which has profited off the backs of families struggling in Ontario, who tonight didn't think you all were worth the time to come out, yet he wants you to vote for him. Ford has kept wages low with Bill 124. He is wasting millions of dollars on luxury spas. And this is what 5 years of the Ford government looks like. He has failed Ontarians. The NDP will use every tool at our disposal to get the cost of living down and work with our federal counterparts. I am not going to sit by. I will join the official opposition, who is the only party fighting for you at Queen's Park.
Thank you for that. And thank you all for answering the questions tonight. I know it was a cross section probably of everything you've been hearing at the doors. And that concludes our formal questions. I know this gave everybody watching and everybody who will watch, as this is a recorded event, the chance to hear a little bit more about you. Some of you have ran before, some of you are familiar to them, but it gives them a chance to see what you and your party would do to tackle some of these issues here in Kanata North. And we appreciate all of your time very much. We'll go into the closing statements. Each of you have 3 minutes to conclude with anything you want to share with the residents as they think about who they're going to vote for. And to kick us off, it's the reverse order of what we started with for opening statements. And we're going to start with Melissa, you from the NDP, please.
Thanks, Danielle. The last 5 years under the Ford government, life has gotten more expensive. Owning a home is unattainable. Cost of living is out of control, and your health is for profit. Doug Ford is only interested in making backroom deals with his wealthy insiders and cozying up to developers at family functions. The Liberal Party has 6 seats at Queen's Park and does not have official party status. A vote for the Liberals is a vote for an independent and a silent seat at the table. The NDP is the official opposition with a fresh and energetic leader who works tirelessly to hold this government and Doug Ford accountable. I am a healthcare worker, a mom, and a proven advocate for Kanata Carleton. I understand the problems of our time. I am right there with you, and it's time for change. We've had conservative provincial representatives for decades. This by-election is the best chance we've had in years to send someone different to Queen's Park, someone who will listen to you, respond to your calls, and fight for you at the legislature. On July 27th, vote for Melissa Conrad and elect a frontline healthcare worker who will fight for you.
Thank you very much. Appreciate that. And Stephen Warren, I should say, with the Green Party, please, 3 minutes.
I want to thank everyone here for coming out and listening to what we have to say. This by-election is an opportunity to send a message. On July 27th, we can tell Doug Ford and we can tell the MPPs in Queen's Park that enough is enough. We've had enough of the Conservatives abandoning our community. We've had enough of the old line parties bickering on the old solutions instead of presenting the real solutions that we need today. We need to see climate action. We need to see job action. We need to see affordable, sustainable housing, and we need to see public health care that everyone can access. This is a by-election. At the end of the day, Doug Ford is still going to be the premier. If you've ever wanted to vote green, but were worried that you split the vote, now is the time to vote green. Do not listen when my opponents may suggest about vote splitting. Vote for what you want. On July 27th, vote green, vote Stephen Warren. Thank you so much. Have a great evening.
Thank you very much. And Karen McCrimmon with the Liberal Party, please, 3 minutes. And you guys are also efficient, so thank you.
Thank you, Danielle. You know, I think that the people of Kanata Carleton deserve effective, capable, experienced representation. I think right now the Ford government is hurting the people of Kanata Carleton with so many of its decisions around healthcare, around education, around seniors care, around the destruction of green space. And so we need someone who's going to be able to stand up for the people of Kanata Carleton. It is just so critical at this time. There is so much work to be done, whether we're talking about more family doctors or more community care or fully funded education or protected green spaces. It all needs to be done. And we're at a time, and this is our opportunity right here, right now, to send that message to the Conservative government in Queen's Park. The Kanata Carleton is not going to take this sitting down. We're not going to accept being mistreated and being ignored in order for him to benefit his friends. This is about our future, and this is about what we want for our future. And for me, we need more community care. We need more doctors. We need better care for seniors. We need green space. We need sustainable housing, and that we need those investments at this time. There are those who will think that perhaps the NDP can beat the Conservatives in this riding, but that's never come close to happening. But I did defeat the Conservatives twice in this riding, in 2015 and 2019, and with your help, I can do it again. You matter. Our community matters, and we can stand up for the kind of future we want in Kanata Carleton. You elected me twice in the past, and I'm once again asking for your vote on July the 27th. I can defeat the Conservatives in this riding with your help. We deserve better than the provincial government that we currently have. It's time for change, and if you too want change, I'm the candidate for you. Thank you very much.
Thank you very much, Karen, and thank you, everyone. That concludes our official event tonight. And I want to say thank you, Melissa Conrad from the NDP. Thank you, Stephen Warren from the Green Party of Ontario. And thank you, Karen McCrimmon from the Liberal Party of Ontario for being here tonight. I know that the community associations and the people that are watching and will watch appreciate your time tonight. Appreciate hearing more about what you think about some of the pressing issues, and we touched on some of the major ones. To everybody watching, on behalf of all the hosting community associations, thank you for contributing your questions that have helped us form these tonight. We appreciated that input and it was valuable. And thank you for tuning in. I would encourage anyone who's watching, if you have questions that haven't been answered tonight that you're still looking to reach out to the candidates. I know that they are going to be out in the community and you can reach them anytime. And as some of them have referenced, mark your calendars. Voting day is July 27th, and the polls are going to be open from 9 a.m. to 9 p.m. And if anybody needs more information, I'd say Elections Ontario, elections.on.ca, or visit their social media platforms. And I'm going to conclude by saying, remember to vote. We have 4 candidates, 3 are in front of you today. You have a choice to make, and decisions are truly made by those who show up. Have your voice heard. Make sure you go out and vote. And I want to thank everyone once again for tuning in, and to all of the candidates here with us today. We appreciate your time. We appreciate your answers. And we're going to let you get back to the hard work that all of you are doing campaigning. Thank you, and good night, everyone.